Hi, this is Jan from Heritage Public Library. Today I'm going to tell you about public health information and where to find it online. I'll share my screen with you now and then I can show you more information. Okay, so hide me. Okay, so the first place I'm going to show you is the Virginia Department of Health. Then I'm going to show you the CDC, the Centers for Disease Control, and the National Institutes of Health, or the NIH. And lastly, something called Virginia Navigator, which isn't a government site, but it's got lots of information to help you. So this is the homepage of the Virginia Department of Health. It is at vdh.virginia.gov. And I do have a handout that we will be attaching to our website, so you will be able to find the links on this. So I'll go back to the Virginia Department of Health website. And all of these websites are kind of large and difficult to navigate. So I'm just going to show you a couple of important things on them. The first one I'm going to show you on here is, go across this menu here, and it says Health Departments. So Heritage Public Library serves the counties of New Kent and Charles City, so we can see what our health department is called, because they are groups of counties and not single counties. So you might not know what health department you're in. So I click on Health Departments, and it's a little bit slow, so bear with me a little bit. So local health districts, and here's a map of Virginia, and you can see there are lots of health departments, and there's several counties big. So this is Charles City, and this is New Kent. So I will click on Charles City, and it'll tell us. It says, you know, we're in the Chickahominy Health District, and it's this green one here, goes around like that, which is kind of an odd assortment of counties, but we are all next to each other. So it should be able to click on it. Oh, well, I click on the word Chickahominy, and it'll take me for more information. So the Chickahominy Health District covers New Kent, Charles City, Hanover, and Goochland. And here is all the information about how to get hold of them. So that's a good thing to know, that they exist, that they cover more than one county, and you know, come here to get hold of them. Okay, so the next thing I was going to show you is on this list, how do I? So if you put your mouse over it, you'll get a big long list of lots of things, and these might be things that you need to know. And I'm going to click on Apply for a Death, Birth, or Marriage Certificate, just to show you that sometimes they tell you to go to a different place. The Virginia Department of Health takes you to the Office of Vital Records, and this gives you the address and the hours and stuff for the vital records, and of course what's happening due to COVID-19 currently with the vital records. And then the thing I wanted to show you in most detail is, I'm going to go back to their homepage, and like most websites, government websites, you can click on their logo and it'll take you back to the homepage. So I will do that and go back to the homepage. And of course, health data and health information is in the news a lot because of the current pandemic of COVID-19. So I want to show you where Virginia Department of Health is reporting Virginia's information about COVID-19. So here is COVID-19 data. So we'll go there and have a look at it. Okay, COVID-19 in Virginia. And I'm going to look at the daily dashboard. And as you can see, it says daily dashboard. This is updated every day and updated before 10 a.m. and closes out at 5 p.m. So it's loading, takes a little bit to load. And this is the official Department of Health in Virginia COVID-19 information. So you can see, here's the map of Virginia, and this is broken down by county, as you can see, and it's got counts of cases. Move this out of the way. And if you scroll further down, it's got a graph too you can look at. So this graph is called the number of cases by date of symptom onset. And as they point out here, illness may not have been reported yet because someone may not have gone to the doctor yet when they've just started having symptoms and haven't got a test yet. So this does show that it went up steadily from March and went down and went up again. So this is cases. And you can also change the statistic to look at hospitalizations, and you click here. And this will also work on some mobile devices, but it may not have exactly the same functionality. So you can see how the map changed when they're showing hospitalizations, because I think cases, there are no counties in Virginia with no cases. Every single county in Virginia has cases now. And hospitalizations, there are several counties that have had no cases. And if you mouse over the county, it'll tell you the name of the county. This is Dickinson County. It's had a total of 11 cases, nobody hospitalized, and nobody died. And I will go over here to show you Charles City. Charles City's had 45 cases, 15 hospitalized, and 3 deaths. New Kent's had 99 cases, 8 hospitalized, and 1 death. So more cases in New Kent, but fewer deaths. And you can see there it also says cases per 100,000 of population and deaths per 100,000 population. So it gives you different ways of looking at it. And then you can also come up here and look at your map for deaths. And it takes a little while to load. It's changing the map for us. And there it is. So quite a few counties have had no deaths, which is a great thing to know. But of course, up here in Northern Virginia, there has been, Fairfax has had 511 deaths. So that makes a big difference. And here we are in Charles City again, 3 deaths. We get the same little box. New Kent, 1 death. And because we changed this little bit here to deaths, we can come down here and have a look at the number of deaths by death date. Again, that went up from March. In March, on this day in March, which is the 5th of May, I mean, sorry, not March, in May, the 5th of May, there were 46 deaths confirmed, and then I got up here and 3 probable deaths. So that was our highest day on the 5th of May. So we come down here and the deaths definitely dropped and they've gone up a little bit recently. So the 13th of July, last week, there were 11 deaths, sorry. And, oops, and this is going to be off the screen. So the most recent day they had data for is actually Tuesday, which was the 21st of July, and there was 1 death. You may see these numbers change because the death certificates have to be given to the Virginia Department of Health before they can be put in here and affect the chart, of course. Okay, so, and you can also check by region, all sorts of things like that. And if you want to look at the raw data, you can also do that down there. Okay, so the next thing I was going to show you was the CDC, because the CDC has been in the news a lot. The CDC is a website I'd like to look at for years. I'd like to look up information about diseases and things like that. And of course, these days, coronavirus is their big story. So what I was going to show you, you scroll down a bit, was information about outbreaks. So they're talking about a foodborne illness here. A bagged salad mix has cyclospora infections. So it's really important for people to know that. And then, of course, coronavirus, lung injury associated with e-cigarette use or vaping, that's going to be an ongoing thing. Bagged salad mix that broke out recently, and backyard poultry, salmonella infection. So these are all links, so you can click on one and have a look. And it tells you, this is June the 24th, so it's just about a month ago, and it tells you about this outbreak. So this one isn't well known, I don't think, but 465 people have been infected with salmonella, and 86 of them have been hospitalized, and they think that contact with backyard poultry caused this. So that's an interesting thing to know, especially in our rural sort of counties, and a lot of people have poultry. So be careful around your poultry. Okay, and I'll go back to beginning. And the CDC has a huge website, and I'm just going to show you a little bit about it. You can search, obviously, and if you go down the bottom, if you wanted to, you can look at it in all sorts of different languages. But I was going to show you something else. Where was it? Where was it going? I have a little list of things I want to do. I like looking at data and statistics. So that's what I'm going to show you. It might not be what you're interested in, but it's well worth looking around the site. It's a huge site, and it's been hours going through it. Yeah, the CDC physically in Atlanta in Georgia. So I'll show you here. So what was I going to show you here? And then I was going to go to injuries and violence. And again, the link for this will be on the handout, so so you can look for it later. You don't need to follow along with what I'm doing. Okay, so I'm going to look at leading causes of death and injury, because there's quite a lot of controversy about that with things that are happening in the news, and this is the raw data. And I like to see the raw data because you read a news article and sometimes they have a bit of spin and they're trying to convince you of something. But so if we go here and we look at the raw data, this is the leading causes of death reports from 1981 to 2018. And this is something about statistics like this, is it is a couple of years old because they don't have it final for 2020, of course, because the year hasn't finished, and they don't have it for last year either because it takes a while to get the statistics in here and all finalized. So I'm going to click on submit request, and we come to this chart, and this is the 10 leading causes of death in the United States in 2018 for all races and both sexes, so for everybody. And this is split up by age group, you can see up here. And these numbers you see here are the actual numbers of people who died. So like any human endeavor, there may be a few that people went missing or something like that, but as far as the CDC knows, this is the exact number of people that died of all these things. And this, you can see the ages go across. It starts with less than 1, then goes up in increments of either 5 or 10 years, and this one is 65 plus. So that's 65 to however, or 100 plus, however old somebody can get. And I think this is really interesting and sad, because if you look at these younger age groups, suicide and homicide are leading causes of death. Unintentional injury is highest for children once they get to 1. Up until you're 44 years old, you're most likely to die of an unintentional injury. And I understand that's most likely to be a car accident. But of course, you can die in an accidental injury in a different way. Of course, for small children also, they can fall as well. And then this is a total of all ages, and the leading cause of death by far is heart disease, and then malignant neoplasms, and a malignant neoplasm is cancer. So 655,000 of heart disease and 599,000 of cancer, and then still unintentional injury is still up there. And then you can see various other ones. And remember, this is the top 10. So there will be people who have died of other things. So they're just not on this chart. So I think this is a really interesting chart to look at, and you can compare it across years. It's reasonably similar across years, but when these boxes move, especially these colored ones that they have here, then you can see there's a trend happening in the world. Because see, in 65 plus, suicide isn't even in the top 10. So that's interesting. Okay, so the next thing I'm going to show you is the National Institutes of Health. And the National Institutes of Health, the first thing I want to point out is it's Institutes of Health, it's plural. And this is in Maryland, and their main campus, and it is like a campus. I've been there, I went to a class there, and it's like a university campus. It's a big area with lots of different buildings, like like a university. So I'll just come over here and show you what institutes are here, list of institutes, and just give you a quick idea of what, oops, where did my list of institutes go? Here we are. This is what I wanted. What I was planning to show you. There's the National Cancer Institute, the National Eye Institute, National Heart, Lung and Blood Institute, National Institute on Aging. The one that I'm really interested in, I'll scroll down because these are alphabetical, is the National Library of Medicine. The grant that Heritage Public Library got to tell people about health information was from the National Library of Medicine, which is actually a library. It has books, it has first editions of Darwin's Origin of Species and things like that, and Florence Nightingale's nursing book. So it's really cool library, but it also, probably more importantly for an average person, it has online information, which I'll show you. And the National Institutes of Health do research. They give out grants to universities all around the country to do research, for scientists to do research about health, and they do research themselves, basic medical research. Okay, so I want to show you what the National Library of Medicine, watch the National Institute of Health, and then part of the National Institute of Health, which is the National Library of Medicine, what information they have that might be useful for you. So under health information here, there is Medline Plus. And Medline Plus is their health information for the public. And I did a class, particularly on Medline Plus, and I will, and you can see it on YouTube, or I will be doing it again, hopefully in library buildings, if we can go in the library buildings and have classes, or I will be doing it via Zoom again. So here is, you can look up health topics with all sorts of things in Medline Plus. And so that is health information, remember. And the other thing I wanted to show you was under research, they have PubMed, which is also really well known. And PubMed, because it's under research, is actual links to actual scientific research papers. So I'll do a very general quick search here. Oops, it's going to be so general. Diabetes in children, and just click on it, and I'll just show you really quickly. It comes up with articles. This is in a medical journal called Best Practices in Research and Clinical Endocrinological Metabolism. So about diabetes, and that was published 2016. So this is actual research papers. Okay, and next I am going to go to Virginia Navigator. And Virginia Navigator is not a government run organization, but it's got lots of links to really important information for you. So it is actually a non-profit, and it provides helpful and free resources, as you can see here, associated with aging, disabilities, and overall well-being. And where was I going to take you for this? Okay. And there's all sorts of agencies in here, and you can look in your local county, and we are 23124 in New Kent, and I'll look up information about aging. And it did come out with a drop-down list, is it? It's been a bit slow. Oh, here we go. Oops, what has it done? Yeah, so the Area Agency on Aging, and then you've got Senior Connections and their address and how to contact them and all that sort of thing. And so you can see the sort of thing it is. All sorts of things about home care and different resources. And I'll show you on the handout that I will be sharing as well, is they also have made these support lines. So there's a support line, it's called the Virginia COVID Support Warm Line, for those who are feeling isolated. There's a National Suicide Prevention Lifeline, all sorts of things like that. And a friendship line, so you can just call it if you wanted to chat. It's the Agency on Aging that put that out. So that's why I wanted to show you Virginia Navigator. Okay, I think that's what I had to go over today. If you have any questions, you can contact me at the library. So thank you for listening today. And I will work out how to close this. Okay. And stop recording.